As we continue with the conversation, we turn our attention now to the discrepancies of testing between public and private testing facilities. For more on this, I'm joined by Dr. Rajesh Patel, head of the Benefits and Risks at the Board of Healthcare Funders. Dr. Rajesh, good evening and thank you for your time tonight. A proper test conducted through a registered pathology lab can give results, we heard tonight, in anything from 48 hours to 2 days, or rather 7 days to 2 weeks, in some instances to even a month. Is there a reasonable explanation why this is so?
I think the bottom line is the scarcity of the test kits itself. That's the one issue, and this is not just unique to South Africa, it's a worldwide issue, the shortage of test kits for one component relative to the potential need. The second important one is, you can have all the test kits and the facilities and resources in the world that you may have. After the test is done and it's performed by the laboratory, you need a virologist, a qualified pathology specialist, to then look at the result before it is released. So it also depends on the availability of the number of virologists that you might have as well.
Does the restrictive criteria of COVID-19 testing in any way help in the containment of the virus? For example, only acute respiratory illness, you would be tested. Only acute respiratory distress syndrome, you'll be tested, or when you have actual history of having traveled, or you have had close contact with somebody. That's the criteria for somebody to be tested. What about somebody who might not be showing signs in any of those categories?
I think because of the limited number of tests that you have and the potential number of people, for example, we've got almost 60 million people in South Africa, and almost everyone, you could say, is at risk. There's some areas higher risk, lower risk. The bottom line is, if we all go over a short period of time to the laboratories, no one's going to be able to cope. So in a system like ours, and also the test kits come in limited batches to South Africa. So you need to, as the MSc talked about, you need to prioritize the testing, and you then therefore target the most groups that are at high risk for the first lot of testing, etc. Then you go to those who are symptomatic, and then obviously if there's still more kids, you can potentially look at the asymptomatic one. But being a medical practitioner myself, I fully support the component that it should be a health professional who triggers the testing to be done. For one simple reason, this test is not cheap. The cheapest potentially you'd get out there in the private sector is between 600, 650 with gift of the givers, and the private laboratories are charging in the region of 850 rand. That's not money to laugh at, okay? It's quite expensive, and therefore you would only want that type of test done if there's a potential need for it. And those who need it, it's very important that we make sure they get it upfront. Yes, there are some asymptomatic people out there, and yes, those potentially might need to be tested. The ones that have come in close contact with those who are infected, etc., those definitely would be asymptomatic. And as you said, they qualify as a person under investigation, and the test would be done. Our labs will be inundated, and if you think we've already got a backlog right now, if you allow anyone from the street just to pitch up at these testing centers, you would find that we're going to have far bigger backlogs than ever before.
Now, certain samples, I believe, particularly for healthcare practitioners, are marked as urgent and are moved to the front of the queue. Even so, there are people who are concerned that they may develop COVID-19 and they won't be diagnosed, or they won't be prioritized in time, one, to get care, but two, to also protect others from catching it. Is that a valid concern?
I think those are valid concerns, but right now, like you mentioned earlier, it's about 1.5 to 2 days to get the results out in the private sector in general. I know in some places they have to be, the testing is done in major centers. So if you're in an outlying area, inevitably they collect the sample, but they don't do the test at that lab where the sample is collected. They have to send it out to, say, a Johannesburg, a Durban, or Cape Town, where these big centers are, where the testing takes place. So often the day that it's tested, by the next day it's then sent out to the lab, and then the next day only at the lab the testing gets done. That's why you've got this 1.5 to 2 days delay at least. which can sometimes go into a third day. But generally, it's 1.5 to 2 days in the private sector, the results come out.
Yeah. How does the limited...
And also, the type of machine we have in the private sector, it allows you to do bulk testing as well.
That's right. And ideally, you should be seeing, I suppose, 5 patients, I'm told, being tested in that one test that is conducted in the machine.
Okay. I think that there's a different type of testing machines around. There are some that can do multiple tests, and then there are some that can do like 4 or 6 at a time. And it depends on the technology you have. And the technology you have will determine whether you can run big batches or you have to do them in small batches. So I'm not sure exactly what the equipment is at the different laboratories, and that might contribute partly to the backlog at the government sector. Maybe they've got the kit that only does 4 to 6 at a time.
Now, the WHO saying test to defeat or detect and to limit the spread of the virus. How does the strategy of limited testing support that kind of a call?
I fully support that you need to test as much as possible. But the thing is, because of the limited supply, you need to be able to manage it. Remember, this is not just a screening test. What government had done, for example, when they sent out community health workers, that's the screening bit that's important that we can do with a lot of communities, a lot of volunteers, etc., can do those, where you ask a few questions kind of thing and then identify who's at high risk. And those are the high risk that you then go and test out.
Now, with just under 16 or 17% of South Africans being covered by medical aid, how do the restrictions or the recommendations by medical aid schemes hamper the work of testing? For example, they don't recommend people be tested who are asymptomatic, who are returning to work. They are saying that is not recommended for them to be tested because it's not a PMB level of care. I mean, that means you will leave out a huge bracket of society that won't be tested and get the clearance to get back to work.
Okay, I think the issue of testing before you come back to work is mythical. The guidelines are quite clear. If you've had a positive test, then after the 2-week break or 2-week period, once you know, it's essentially about 2 weeks. And once the 2 weeks are over, you can then go back to work. There's no need to have a second test or anything like that. You don't need to show that you're negative. As long as you were exposed or whatever exposure you might have had, if you waited and self-isolated for 2 weeks, you're then fine to get back to work without having a test done. The evidence is there. It's in the guidelines as well that there's no need for a test after the 2-week isolation. And I think that's what the MEC was indicating as well. In the beginning, we were testing a person. Initially, he was diagnosed positive. And then after 2 weeks, there was a test again done before they could go back to work or back into their normal involvement, etc. That second test is no longer required.
Dr. Rajesh, then let's talk about the capacity of us being able to test more. I mean, if you look at the numbers of tests conducted in April, were around 108K. Now we are in June sitting at over 1.2 million tests being done. Is that a good rate?
I think we can do a lot better. If you look at compared to the international and many of the other countries out there, we lag behind on that component. But I'm not sure the exact reason why we're lagging behind, whether it's a supply issue or not. I think the best people to answer those questions would be like the NHLS and the practitioners in the private laboratories. I think they can tell us more accurately the details about whether the test kits are coming through in sufficient numbers or not.
As far as capacity is concerned, how well are we to be able to handle the peak that is coming in the next couple of weeks?
I think not even the next couple of weeks. I think we might see the peak close to August or so. I must give recognition to the Department of Health. I think the way they've conducted themselves throughout this early phase in getting the country ready has been really good. The advisory committee, their advice has been very good. And I think come the peak, etc., or the next few weeks, as you talk about, I think we'll be reasonably okay to deal with most of the what you call it, most of the beds that get filled, etc. There's been a lot of planning that went into it. There's a lot of work that's going into it, and I think they have prioritized, reprioritized, etc. And I think it's going reasonably well, and I'm quite confident that we potentially might get through this quite well.